Hello, a warm welcome to you from SGD University. I am Dr. Tokika Yoptami from Faculty of Naturopathy and Yogic Sciences. Today, we will be learning about Sitz bath.
Prisnitz, an Austrian physician, used water in the treatment of many diseases. He found the Sitz bath to be of great value in the treatment of constipation as well as other abdominal disorders and pelvic diseases. One of the oldest and the most valuable of all hydrotherapy treatment or procedure is the Sitz bath or the sitting bath. So, what is Sitz bath? The Sitz bath is an immersion bath in which the patient sits in the water of appropriate temperature while keeping his feet in a hot tub bath. It is a therapeutic bath used to heal and cleanse the area around the perineum, which is the space between the genitals and anus. Sitz is from the German word sitzen, which means to sit. Types of Sitz bath. Depending upon the requirement and water temperature, Sitz baths are of the following types, that is, alternate Sitz, cold Sitz bath, neutral Sitz, revulsive Sitz, hot Sitz. Equipments. The basic essential requirements for Sitz bath treatment include the following: bath thermometer, wash tap, foot tub, lightweight blankets, basin of ice water, compress, towels, and boiling water. Procedure. Following procedure should be followed for Sitz bath. Fill a tub with water so that it covers the hip and reaches up to the mid-abdomen. If possible, immerse the pelvic and abdominal region in the Sitz bath water with your feet immersed in another basin with water, which is a few degrees warmer. When using hot Sitz bath, the tub should be filled with water about 110 degrees Fahrenheit. Place cold compress on the head and neck during the hot Sitz bath. Conclude the hot Sitz bath by cooling water to neutral or pouring cold water over the hip. For cold Sitz bath, fill the tub with ice water and stay in the cold bath for 30 to 60 seconds. Then towel yourself dry. For alternating hot and cold baths, fill one tub with hot water about 110 degrees Fahrenheit and a second with ice water. Stay in hot Sitz bath first for 3 to 4 minutes and then shift to cold Sitz bath for 30 to 60 seconds. Repeat this for 3 to 4 times. While the water alone may be enough to promote healing, sometimes additives such as salt and other ingredients are added to help reduce itching and swelling. Some of the more common add-ins include Epsom salt, sea salt which is non-iodized, witch hazel, vinegars, sodium bicarbonate, etc. Physiological effects. Physiological effects occur depending upon the water temperature and duration of the treatment, such as the following. Cold Sitz stimulates contraction of pelvic blood vessels, uterus, and bowel musculature. Alternate hot and cold produces fluxion, whereas neutral Sitz is sedating and calming. Indications. The Sitz bath is an effective at-home treatment for conditions such as hemorrhoids, uterine cramps, painful ovaries and testicles, fissures, prostatitis, genital herpes, and chronic constipation. It can also be used after childbirth to help heal tear after a vaginal delivery or for any surgery in the anogenital region. Pediatricians will often recommend a Sitz bath for children experiencing uncomfortable bowel movements or who have a rash or chafing in the perineal area. Therapeutical benefits. Sitz bath has a great therapeutical benefits besides its easy and safe use. A Sitz bath can reduce inflammation, improve hygiene, and promote blood flow to the anogenital area. Common uses of the Sitz bath include keeping the anus clean and discomfort caused by hemorrhoids. Used for healing perineal and vaginal lacerations after vaginal childbirth. Used for relieving discomfort from bowel movements such as constipation or diarrhea. Relieve pain from anal fissures formed by little tears inside the anus. Soaking in warm water on its own can help speed up the healing process by boosting the blood flow to the affected area. Precautions. To avoid any complications during or post sitz bath, certain precautions should be followed. That is, one should not add shower gel, bubble bath, or any type of soap, as this can also dry out damaged skin. Gently pat your anal area, perineum, and genitals dry with a clean towel. Don't rub the area. Wash your hands. Put any ointments or cream on the area if advised. Wash the bathtub or sitz bath bowl with soap and water after each use. Use a sitz bath 2 to 3 times a day or as often as your doctor advised. Stop using sitz bath and contact your doctor if the pain or itching worsens or if your perineum becomes red and puffy. Tell your doctor right away if you get heavy bleeding, bad smelling fluid, a fever, and swelling or redness in your pelvic area. This could be a sign of an infection. Risk factors and aftercare. A sitz bath carries very little risk of harm because it's a non-invasive treatment. The most common adverse event associated with sitz bath is infection of the perineum, but this rarely occurs. This may happen if you are caring for a surgical wound and do not clean the tub or plastic bath thoroughly. If sitz baths brings you relief, your doctor will probably recommend taking 3 to 4 times per day until the source of itching, irritation, or pain is healed. After you have had a sitz bath, you may immediately return to normal activities unless your doctor has told you otherwise.
So, today we have covered sitz bath. The next time we meet, we will be learning more about hydrotherapy treatments. Keep learning, keep growing. See you next time.